Hi, it's me, Calores. I'm performing a sterile wound irrigation. I've already provided privacy for my patient. I've introduced myself. I've done the hand hygiene, and as you can see, I've put on my PPE equipment. Okay, I've also adjusted the bed, got my supplies. I have the abdominal, the absorbent pad under my patient. Um, I am gonna clean my hands again so that you can see me do that. I'm going to go ahead. I've assessed her for pain. I've got her, like I said, I've asked her name and her date of birth, her allergies. I've educated her on what I'm getting ready to do. She doesn't have any pain. I've got my sanitized hands. Now we can go ahead. Um, I'm going to put my clean pair of gloves on. Okay, and we're going to prepare to remove the old dressing. Okay, so we're moving the old dressing just like I did earlier. You want to the corner, and you want to get it working towards the wound, lifting up the corners side at a time. Okay, so then we have the dressing here, and we're going to take this out, checking it for drainage. I'm going to go ahead and put that in my trash here. And again, I'm looking for the drainage, looking at the color, any odor. If you need to measure it, again, you can do that as well, just like I did earlier. You can go ahead and measure it in centimeters, okay? If I want to check the depth, that's exactly what you would do, and then you can go ahead and measure it. You want to go ahead and you would dispose of that. So we remove the old dressing. So then what I'm going to do is remove my gloves. Okay, then I'm going to sanitize my hands. Okay, so now we're going to do the sterile field. So we're going to open up the kit here. And we just want the borders. Touch the borders here. I'm going to slide this down so you can see. Okay. I'm going to go ahead and take the supplies out. Actually, what I'm going to do is open up the supplies that I need, is what I'm doing. So, gloves, we have the tape. I don't want to touch inside. I'm going to go right ahead and pour my solution directly into the basin. Okay. Actually, I'm just set that right there, so I'm going to get rid of it. Okay. So now that I've got that done, I can go ahead and apply my sterile gloves. So, I've got the little corner here. And I'll put on my sterile gloves. And we'll remove this, okay, into the trash. And I've got the basin, so that would be, the basin would be below the wound. I'm gonna go ahead and fill my syringe with the saline. Okay, so then I'm gonna have to slide this over so you can see it because my screen is only but so big. But I want to do a direct stream into the wound is what I would do. Okay. And, you know, once the water is clear, or in this case I'm using normal saline, it's clear. Okay, so then I'll go ahead and get rid of that. You want to blot, you know, and put it in there. You just want to do it the one time, like I was saying. And then you discard of it. Okay. So once we've done that, some people, after it's completely dry, again, you can go ahead and put the skin protectant around the wound. Okay, you would get rid of this, get another swab, or if that's what you want to call them, and then, you know, go ahead and do the other side like that. And then you can, after that, I want to remove my gloves, perform hand sanitizer, hand hygiene, okay. I'm going to put on another set of sterile gloves. So we're going to follow the same format. Lifting up from the cuff. I'm tucking my cuffs in so that they're not everywhere. Okay. I got rid of that. And then what we're going to do is we're going to pack the wound. Okay, so I'm going to put the goals in here. We're packing the wound, just like we did before. Apply the gauze dressing 1 inch beyond the wound border. Then we'll apply this, the abdominal pad. Okay, we'll go ahead. We'll tape the dressing again. Get that nice and secure. Alright, so what I do is I start out with the tape and I do it around the borders, and then I also like to, you know, secure more tape in as you know, across there as you need it. Then I take the tape and I'm going to label it, get a pen. You can put the date and the time and your initials on it. And if, you know, I'm not going to use the tape anymore, so I'm going to go ahead and dispose of it. I'm going to go ahead and I'm going to remove my PPE is what I'm gonna do. So, I'm gonna take my, let's get it together here. So I'm gonna take off, it's hot, and I'm sitting up here trying to think what I'm gonna do. So what I'm doing is I'm gonna take my gloves off. Okay. I'm gonna start out with taking my glasses off. And we're gonna pull that by the ears. You can either save them or you can dispose of them, whichever your facility, you know. These are considered dirty, so you want to pull that by the ear and take it off. Okay. As far as this is concerned, now this, you know, is dirty. So I am gonna go ahead and untie it. Okay. Not touching the front because that's and then you want to shimmy it so that it can get it off of here. Okay, and then you want to put it into a little ball and dispose of it. I'm going to, like I said, I've got my patient comfortable. I've adjusted the bed. She's got a call bell within reach. Hand sanitizing, and then I'm documenting. That concludes my sterile wound irrigation. Thank you.